of the series, as you know, because we've been through them before, and I hope that you're finding, now that we're getting to the halfway one, that you're beginning to get an idea about the relationship between the principles and policies that are involved in eHealth strategy development and how strategies can be delivered. Provided.
Hope you could share your slides or share your desktop with us so that we could see your slides.
I should be sharing my desktop with you. Sorry. Can you see that, Olivia?
Yes, thanks so much.
Sorry about that. I was too keen to press on. Okay, so standards and interoperability webinar for the purpose. So basically, I hope you're understanding now the relationship a little better between strategy, policy development and implementation, provided you've got the appropriate skills and training. And that's certainly an important issue in the context of standards and interoperability. And you'll see on the eHealth capacity roadmap on the left-hand side, kind of the fourth row up, National Standards and Interoperability Framework, NSIF. And that really is the level that we're talking about today, standards and interoperability. And then next week on Monday, we'll talk about health information exchanges, which is kind of interoperability in practice, or testing how well interoperability works in practice. So standards and interoperability, next week health information exchange, and let's start then with just explaining briefly that in this webinar, we'll show where standards and interoperability fit within the toolkit, discuss some of the core competencies that are needed by people such as yourselves to deal with data standards, implementation and maintenance, and then talk through some of the standards that are needed. And I'll go over each of these in more detail, obviously, core communications, meaning, structured messaging, identifiers, data models and dictionaries, and importantly, information, both for health professionals and the public. And then I'll give you some examples from or of standards development organisations for health, and some of the available online training programs, so that you've got some places to start your search to find what is going to suit you best. So I hope that will be a helpful session for you. So first of all, standards and interoperability is one of the major eHealth components. And as I think I said in answer to a question on the first webinar, or perhaps even the introductory one, the eHealth Strategy Toolkit says that all components need to be considered, even if not addressed in the final strategy. But having said that, I can't really see how any eHealth strategy is going to be able to be finalised unless it addresses standards and interoperability. It sits, as this diagram suggests, right in the middle of everything. Everything really revolves around having standards and interoperability that enable us to, in a meaningful way, consistently meaningful way, which we'll talk about more later on, be able to exchange information. And if you look in the strategy, pages 53 to 4, you'll see a slightly fuller version of this table, which gives an indication of the ways in which standards and interoperability issues play out with the different components, and briefly what each of those components are about and some examples. So that's just to sensitize you to some of the issues that we're going to be covering during the course of this webinar. And just to draw your attention to the bottom one, where the description is that the software accreditation standards are important as criteria to enable the exchange of eHealth information by software products and services. So it's that ability to exchange eHealth information that is what this is all working towards, and we'll see some of the issues around that process in the next webinar. So if I can move then to another recommended stage in the toolkit, which is to do with gathering information on the eHealth environment. And of course, there are all sorts of things in the eHealth environment about which information may need to be gathered. And the outputs of this process are given there. But what I really was wanting to say was, okay, so in the context of standards and interoperability, if you, in your country, are needing to understand what's going on or to ask people to find out for you, what are the sorts of questions that you might have to ask or have your colleagues to ask? What is it that would be of relevance? And this next slide is an example of the sorts of questions that may be relevant in assessing progress in terms of standards and interoperability. They are questions really for you to consider. And the subtext behind this, my question to you is, and do you have or can you access the competencies that you'll need to be able to deal with the process of asking and answering these questions? And that, in a way, is what I hope this webinar, this particular webinar and the series in general, will be helping you to do, to feel a little bit more confident about having an understanding of the major topics that need to be covered and having some idea about where to go to get some more detailed advice and guidance and support so that you have got the capacity that you or your colleagues need to be able to address the issues in developing an eHealth strategy and, more importantly, delivering it. So these are some of the suggestions that I think make sense, and again, it's something that's been derived from the toolkit. So I hope you'll find that of interest and relevant for you, and ask yourself, do you know how to go about asking and answering and understanding the answers to these questions? So I've been implying that there are a lot of competencies that are needed, and this next slide is addressing that issue. And there was a workshop held in December 2012 that was attended by some very important people, which included Dr. Alvin and also Mark Landry. I was not there, but I read their report with great interest, and I wanted to share with you the 7 kind of key findings that emerged from the discussions that they had about the core competencies for health data standards implementation and maintenance. So the first one, knowledge of global health and country-specific health systems. Basically, these are issues that we touched on in the first webinar, where I was pointing you to some of the global sources of information, encouraging you to kind of keep up to date with what's going on at a global level. Knowledge of health informatics standards, terminology and interoperability, this is really what we're going to be majoring on today. I think the third one, about the knowledge of ICT implementation and management in the context of national eHealth strategies, is a good summary of what we're trying to cover throughout the whole series of these webinars. The ability to monitor and evaluate eHealth systems and services we'll look at in more detail in webinar 7. And then, as I think I flagged up in the introductory session, the ability to develop budgets and costing of eHealth systems and services is not something that I've got lined up to cover in this webinar series. And it's not something that so far as I could tell, was explicitly referenced in the AeHIN capacity building roadmap. So that might be something for some further consideration. The knowledge of policy and program planning, I think, is covered in all the sessions that we're doing. And leadership, communications and project management skills, well, the leadership one was certainly a focus for webinar 1, and the project management skills will be covered in more detail in webinar 6. So I hope that most of the competencies that you or your colleagues will need I'll be addressing in this webinar series, but you've got there the reference to the document that is certainly worth having a look at. It was a report of a workshop, and so this was summarising the findings of one of the working groups that was addressing this particular topic. So have a look at it. I thought it was quite a helpful document myself. Okay, and then also in 2012, there was a document produced by the ITU on eHealth standards and interoperability. And again, this is another document that has quite a lot of interesting material in it. And I've just picked out the challenges and prerequisites that it was flagging out. And you'll see that the way in which the challenges are framed is such that you can understand they are actually pretty generic challenges. And I think every health system that is investing in an information infrastructure, and that means almost all of them, will recognise these systems. That currently there's a huge number of old legacy systems, maybe locked with proprietary technologies and architectures that lock people in, lots of complex data, all sorts of different standards being needed, big challenges in having the right eHealth infrastructure and network management, and also a number of different standards initiatives taking place in different institutions that seem to overlap. And during the course of this webinar series, and today's a good example, I'm going to be covering quite a number of these standards. And what I'm hoping to do is that as we get towards the end of the webinar series, and I'll summarise these in the last one, webinar 8, as to how these different standards kind of relate to each other. So I hope that if you can stick with it till webinar 8, you will have a better idea than perhaps you have right now about how these different standards relate to the different topics that are being covered. But suffice to say, overlapping standards initiatives taking place in different institutions is a major challenge. In terms of the prerequisites for addressing these challenges, this document was stressing the need to emphasize greater interoperability and also increasing coordination of eHealth standardization. I suppose you might say that coming from the ITU, they would say that, wouldn't they? But I think it's a fair point, and most people working in any part of the IT business would support in any domain both efforts to ensure greater interoperability and coordination, provided that privacy, security and safety are addressed. And you will know from events over the last 12 months just how interrelated these issues are. The standardization gap in the developing world is big and needs to reduce, and that's partly what we're trying to address here. And the fifth point, I think, is again an interesting one, and one that I feel a little concerned about, in that I don't feel that at the moment, certainly in this webinar series, the issues around mobile devices and social media are really getting the attention that perhaps they should have. Again, rather in the same way as the budgetary point, I think there are important issues here that we would be worth exploring and developing further. So I think this is a reflection of the relative suddenness or of these issues appearing on the agenda. Mobile devices and social media have not yet had a significant impact on the information standards bodies, and there are some interesting issues to be addressed there. And so that's another area for you to be paying attention to. So I think this is a good sort of place to stop and just see if there are any questions that you may have, as we've kind of covered the introductory material, and then we'll get into what interoperability is all about. So Alia, I'll hand back to you and see if there are any questions or issues that people want to raise at this stage.
Thank you, Dr. Peter. Are there any questions from the floor? Are there issues burning at the moment? And you could also share your comments and your suggestions in our chat box. If you have questions, you can just type it in our Q&A panel. All right. While waiting for the questions of our participants, Dr. Peter, I would like to ask, you have mentioned a while ago in your previous slides that there might be some parts of the WHO ITU toolkit diagram that might not be, or some parts of that diagram that might be left behind by national government agencies. And you've said also that everything or every part of the diagram should be considered. So my question is, what would be the danger of leaving one part of that diagram behind? For example, one part was not considered by a national government in implementing their strategy.
Yeah. Well, the easy answer is to say that they would have an incomplete strategy implementation, and therefore, there would clearly be room for improvement. But I think another answer is to say that in reality, this is a process, and every country is different, and the pace at which standards and systems and policies and programs can evolve and change and be implemented will vary. And in just the way that I said that in the toolkit, the recommendation is that all of the components need to be considered, even if they're not addressed in the final strategy. I think, and I hope, that people attending this webinar series will feel that when they come to the end of it, they will have an idea about all the different standards and issues that lie behind them that need to be considered. But that's not to say that they need to be addressed all at the same time. So there's a prioritization process that may be needed, and the way in which those priorities are set will vary between country and depending on the nature of the legacy systems that they have. The COBIT framework that we mentioned, in which I will use, and you'll see in webinar 8, how it provides a very useful basis on which to layer almost all of the other standards that we've been talking about. That, I think, will help you then reflect on how, in your local circumstances, you can address the issues that need to be addressed. And over time, you'll find that all of the issues really do need to be addressed, but it is a process, as I say. So the important thing is to take informed and thoughtful decisions in the light of what you can achieve, having done your environmental scans and assessment, which we've just covered. And in the light of that knowledge, prioritize what you need to do in the short, medium and long term, and knowing what you're doing, and also bearing in mind what you may know by keeping in touch with what's happening through your regional networks, e.g. via AeHIN, or through keeping in contact with the global networks of information standards development, so that you know which of the new standards that are emerging, you know, what's about to come out, and what are the issues where there's still quite a lot of contention going on, so there won't be much chance of that particular problem being addressed within the next 12 months. So I hope you're getting the sense that it's not as simple as saying do everything, otherwise it's incomplete. It's a much more complex and dynamic process, but the important thing is to have a framework within which you can make some informed judgments.
Okay, thank you, Dr. Peter, with a very comprehensive answer, and we really appreciate the differences that our culture and our countries are having, which means that we can tailor fit the implementation of the WHO ITU toolkit to our country's national setting. There is a question here from Dr. Shed Mursalin. I think Dr. Shed is from Pakistan. Should standards be developed nationally or adapted from some international organization? And secondly, should national systems be compatible with those international ones? I think this question keeps on being raised in our webinar so far. So for you, Dr. Peter, what could be the best answer for this question?
Yeah, I think the danger comes if national standards are developed without reference to the international standards community. And although it may mean that things may be easier to do in the short term, given that the long-term trajectory of the way health systems evolve is going to increasingly require the ability for the exchange of information between countries as well as within them. The challenges of doing this are immense, and I think that where there are international standards that have been developed by bodies of experts from different countries and that have been tried and tested, then they should form the basis of any national standards that are then to be implemented. Now, there may be certain circumstances, and in fact, I will give you an example of some from the UK, where it may well be the case that in a particular country, you, for a variety of reasons, have leadership in a particular area. So, for example, to give an example from, let's say, South Africa, or I could easily take it from West Africa. If you think about traditional medicine, herbal remedies, understanding of traditional medicine, how is that knowledge evolved and coded and put into drug dictionaries? And would an international drug dictionary have the capabilities of supporting what is of relevance and meaning in a particular local country? Probably not. So national standards there would be very good to be developed and then fed into international bodies so that knowledge of those techniques can be shared where that's appropriate. So again, I don't think there's a simple answer to this, except to say that where there are international standards, use them, but be prepared to adapt them to make sure that what you implement nationally is relevant, subject to the strategic objective of enabling your citizens to be able to have health information, their health information about them, capable of being exchanged in a meaningful way if they themselves choose to have healthcare elsewhere because they're on holiday or they've travelled or for whatever reason. So there are those tensions to be managed, and the solutions may vary a little bit depending on the nature of the country and the issue. Hi.
Can you repeat what you've said for the last 3 seconds? We weren't able to hear you.
Oh, sorry. The key thing, I think, just to summarise, use international standards as your default position. However, be prepared to adapt them for use nationally. But if you do develop standards nationally, and there may be good circumstances where you have a particular lead in certain areas for why you should need to do that. But whatever you do, bear in mind that your citizens, or the citizens of your country, should be able to expect that when they travel, for whatever reason, to another healthcare system, that their health information that they've had recorded in your country can be shared in a meaningful way. So national standards may enable you to make more rapid progress, but that doesn't necessarily mean that they are the right thing to do all the time. Discussion.
Thank you, Dr. Peter, for your answer. I think the most important thing that you've mentioned is that the danger of not implementing, the danger of implementing a standard that you have created is that you have not yet tested it. While if you implement a standard that has been internationally recognized and accepted, then you will be ensured that it will serve its purpose.
Yeah.
So we go now for the next question that we have from Dina. Dina gave a comment that
sorry, I'm missing this earlier. I can't hear you.
That in Indonesia, especially in the This question came from Dina Ningrum from Indonesia. In Indonesia, especially in Semarang City, we have developed an eHealth software that is web-based and MySQL database and has languages such as PHP and HTML since 2004. And she said that they have developed these eHealth software because it has a potential for it has the potential to interoperate with other technology. So her question now is, how do countries like Indonesia set their standards for accrediting eHealth software?
Yeah. Okay. Well, I would say if you want to set the standards in Indonesia for accrediting eHealth software, don't reinvent the wheel. Look, first of all, at what the other software accreditation standards are internationally, and then, having looked at those, decide what will be of most relevance and use to you. And you may find that you don't actually need to develop as much as you thought you did in Indonesia. So, although, as I say, you may feel that it's a quick and effective and perhaps cheaper solution in the short term to be able to make progress in developing software accreditation standards, before you actually do that, my advice would be make sure that you are aware of what the international standards bodies are up to, and that you are also knowledgeable about what the major suppliers are doing.
Okay.
All right. So,
all right. Go ahead.
Can you hold the next question now? Because I just like to get going on the next part of the session. Otherwise, we'll find that we run out of time, if that's okay, because there's still quite a lot to get through. But there'll be another question and answer session later on, so I'll certainly come back and deal with the question that I've answered now then.
All right. So go ahead for the next session.
Okay. Thanks, Anne. So, when we say interoperability, actually, what do we mean? Because if you're confused about what interoperability is about, then it's not going to be interoperable. So, there was quite a helpful suggestion made by Ed Larson in 2005 that is referenced in the HL7 documentation. You've got it there. But he was distinguishing between technical interoperability, semantic interoperability, and process interoperability. So the first one is really to do with the kind of core infrastructure issues, and I'll talk more about those, as I will also about semantic interoperability, which is to do with meaning and making sure that what is exchanged using codes and identifiers from one context means the same thing when it's reinterpreted at the other end. And then the third one, to do with process interoperability, is really about how human beings understand and process information. And unless that is also part of the understanding of what interoperability is, then you may have systems that can exchange information unambiguously, but you don't have the people who've got the skills to make sure that that data and information can be used in a knowledgeable and a wise way. All right. So there are those three different ways of looking at it. And in terms of what I'm presenting, I've kind of used a slightly different set of terms, but basically core, what you'll see me describe as core standards that to do with communications, transport and security. The meaning or semantic standards around vocabularies, messaging, identifiers, data models and dictionaries. And I'm not going to talk really so much about the services aspect of this, because the application programming interfaces are more relevant. I'll touch on that in the next webinar on information exchange. and then the third one to do with information. So if I can now give you a lot of acronyms, but thankfully also what they each mean and a comment on them. I'm not proposing to go into the details of any of these, not least because the details of them are completely beyond me, but on the other hand, it is important, I think, to know that these standards exist, broadly what they mean and what they're there to do. Just to draw your attention, though, to the two at the bottom, because as I've mentioned previously, and I'll mention again in other webinars, the security issues underpin all of the ways in which we are looking to develop eHealth solutions and systems. And unless you have secure systems, people will not have confidence in the information that is being held or processed and exchanged. And unless people have confidence in it, they won't use it. So this is a fundamental requirement that we address the security issues. And I just wanted to use that as a segue to point you to one of the ISO IEC standards, 27001, which is recently reissued. And it is helpful from the point of view of management in terms of understanding the sorts of things that need to be done to make sure that you have a secure management information security management system, ISMS. And it gives some kind of a checklist, a framework of issues, but it doesn't mandate specific security controls. It's things like, is access to the operating system controlled by secure login procedures? Is there a policy for cryptographic controls? Those types of questions. So I will cover some more security management standards in webinars 6 and 7. But since we were covering security at the end of the previous slide, and because I want to make the point that it is an issue that underpins everything, I thought it would be helpful just to pop in a slide on standards for information security management. So those are some of the major core technical standards. Turning then to some of the semantic standards that govern meaning. These are the major ones, and these have been under development for many years, most often. ICD certainly has, and the American Medical Association has been working for a long time on parent procedural terminologies. Regan Street have been working on LOINC for medical laboratory observations for some time. SNOMED became SNOMED CT in 2004, and it involved a joining up of the SNOMED terminology that the College of American Pathologists had developed and the Reed-coded clinical terms that had been developed in the UK. And we combined those systems. So that's been running as SNOMED CT for about 10 years. And it's owned now and maintained by a new and very really important body, the International Health Terminology Standards Development Organisation. A bit of a mouthful, but it does describe what it does. The National Drug Code, Universal Product Identifier for Human Drugs. I think there are also, as I was saying in answer to a question earlier on, very relevant national drug issues that may very well need to be developed, for example, in Indonesia. standards for drugs that are used across the whole health system in Indonesia might be quite different from the ones that are used in the UK or in South Africa. So, nevertheless, the important thing is that people who are using drugs and needing to exchange information about those drugs have to be able to do so unambiguously. The meaning has to be clear, and that's what a drug code and dictionary is about. And then in terms of sending the messages that contain this meaningful data, fundamentally important are the message transport standards, XML and SOAP. But then the format of the messages are the ones that have involved the healthcare industry. So the first two, the message transport, those are generic, but healthcare has done a lot of work using EDI, DICOM, CDA, and HL7. And you'll see that the DICOM standard, for example, is looking at the standards for handling, storing, printing, and transmitting information, medical imaging, medical imaging, and it's a standard message format. HL7, the one at the bottom, is another very important one that has been under development again for well over 25 years. And I just thought I'd share with you an email that I got yesterday. It was a news item from HI, the health IT, called Health Data Interoperability Insight ... by EPIC. And this included in it some of the current issues that there are in dealing with interoperability. And basically, what's happening in the States is that the challenges of developing HL7 so that it enables complete interoperability have proved to be really quite significant. And in practice, what's happening is that there are a couple of suppliers, one of which is EPIC, which has developed its own variations of enabling interoperability. And there's now quite a lot of anxiety being raised as to whether this is appropriate. You know, so you may recall that about 15, 20 years ago, there was a kind of a catchphrase that said, nobody ever got fired for buying IBM. It was kind of a safe thing to do, and you wouldn't be sacked if whatever you bought was actually an IBM. But the standards community are now getting quite concerned that an equivalent issue may be happening in healthcare interoperability, to the effect that, in the States at least, nobody ever gets fired for buying EPIC. And there's a really serious issue evolving here, I think, which is the tension between having interoperability being defined for commercial gain by a particular supplier and having interoperability as a internationally clinically determined process for delivering unambiguously information between computer systems that is independent of any particular vendor's standards. So just to flag up to you that even when you have an organization like HL7 looking at interoperability between healthcare systems for many years, in practice there are now challenges where within a particular country, in this case the States, there is a particular solution that seems to work, but there is a pushback from the interoperability community who are feeling very anxious about the thought that health information and IT standards could become owned by one particular vendor. So that's quite well. This came through yesterday, so it is a current issue. Okay, identifiers. We have identifiers as individuals, and we have identifiers for health practitioners, and we have identifiers for health organisations, and we need national healthcare identifier services. And what I wanted to just, in a sense, stress here is that I think one of the really important fundamental issues that need to be addressed at a national level is the whole issue of identification, and whether individuals, practitioners, or healthcare organisations are being, or information about them is being exchanged. It seems to me vital that that is done unambiguously, and therefore there is a lot of merit, it seems to me, in having some form of national healthcare identifier service to uniquely identify individuals, practitioners, and organisations. And I've given you there some references to Australia and New Zealand, where they've addressed these issues quite seriously, and there's some quite helpful background information from them. So when I say individuals, I mean individuals both as citizens and if citizens become patients. So from the health sector's point of view, obviously the identifying individuals as citizens is not part of the remit, but identifying them uniquely when they are patients certainly is. So we have in the UK the NHS number, and that's the health-related identifier for citizens. So whether you're healthy or whether you're sick, you will have an NHS number, but it's for use in the health service. It's not for use in any other setting. So those are some thoughts about identifiers, but then, as is implied here, there are some very rich and complex data models and data dictionaries that are needed to enable all this information to be properly handled. And I've given you there a link to the NHS data dictionary that was revised. I think it was about this current version was released, I think, about 4 months ago, so pretty recent. But there's been work going on this for the last 20, 25 years. So again, it's an evolving process. But you'll see that, and if you have a look on the site, and the reason that I'm sharing this with you is because I think it is one of the best international efforts at data modeling and data dictionaries. You'll see when you look there that each of these different elements can be unpacked and described in detail. So if you look at the diagrams, for example, you'll see a diagram for a person identifier, and then the person identifier as a patient, and then you'll see they have an NHS number. And if you want to know what does a patient mean, how do you define a patient, then you can click on patient, and it opens up a box that gives a description of attributes, relationships, and where it's used. So there is detailed definition given of all these different elements, and it is a huge, absolutely huge data model and data dictionary. But it's needed because healthcare is a very rich, health and social care is a very rich and complex organisation, as we have said from time to time throughout. So that's something to bear in mind. And then I want to look at the third category, the information category. And you remember what I was saying was that it's all very well to have technical core standards that are working well and being able to exchange data that is meaningful system to system, but you've got to have professionals who understand how to use this. And again, the work to get this established has been going on for a long time here in the UK, but I wanted to share it with you because I think the Professional Record Standards body that has been set up now in the UK is a pretty good benchmark for others to have a look at, because what they're trying to do now is to make clear to all the different clinical professions the importance of having the right records, and that it's part of their professional duties to be able to use and maintain those record systems. But you'll see on the fourth bullet point that they are also engaging with system suppliers and education and training organisations, and that's very important too. So professional standards for the use of health and social care records by health and social care professionals is a very important step forward, and gives us an opportunity, I think, to make sure that the decisions that are made by system suppliers and educators and trainers can be well aligned with what the health professionals themselves are finding they need when they're caring or trying to improve the care that they give to individual patients. And the other image of this is the information standards being held in a single place. So all the information standards, along with supporting material, e-learning, implementation guidance, case studies, is now being held for information standards professionals in a single place, infostandards.org. So whether these are for clinical professionals or information standards professionals, good practice, I would suggest, from the UK is suggesting that it's an appropriate direction of travel to have organisations set up to handle the specific interests of these particular groups of people, clinicians and the information standards specialists. So you need that to understand the meaning and the importance of standards. Now, similarly, for the public, again, I think the UK has been leading the way in terms of developing good information for the public. And NHS Choices, the second bullet point, has been running for the last 10 years. And if you look at their website, you will see that it is very much geared to enabling citizens to take well-informed decisions about the choices that they can make, whether it's finding out more about the illnesses or symptoms that they may have, or where they can go to get care and support, or to find out some current and relevant and interesting news. That's all a possibility for them using the NHS Choices website. And then the more recent thing is NHS Choices has been actually quite a key mover behind setting up an information standard certification program, because what they're recognizing is that and I'm sure this you will all understand that this is true in your countries as well. There are all sorts of bodies that are producing information about health-related issues. And the question is, well, is it sensible or is it rubbish? And basically the information standards certification program is now set up in the UK setting, at least, to try and make sure that there's clear, accurate, balanced, evidence-based and up-to-date knowledge available. And they've got 3 independent organisations to carry out the assessment and to then offer the certification, so that if you're wanting to be reassured that what you're reading is of good quality, then look out for that information standard logo on it. That's the gist of it. Okay, so that's taken us through the standards in terms of the core standards, the technical core standards, the technical interoperability, the semantic and messaging standards, and the use of identifiers and data models and dictionaries for the semantic interoperability, the way in which meaning can be exchanged. I've talked about the importance of information or kind of process interoperability so that people, whether they are citizens, as on this slide, or clinical professionals or information standards professionals, are able to share or to be able to access good quality information and share that knowledge unambiguously with others. So what I just wanted to move on to now, just before we have the next Q&A session, is just to say, well, and these are some of the key standards development organisations. So you've seen that I've referenced standards like the 27001 standard, is an ISO IEC standard, and you can see from this that that's referring to a standard that's been jointly developed by the International Standards Organization and the International Electrotechnical Commission, the IEC. And I also wanted to include in there the W3C, because the standards that define open web platforms for application development, I think, are really important to be aware of. And again, when we talk about health information exchanges that enable services to interoperate on Monday, some of these issues are kind of predicated on there being a set of open web platforms that can be used. There are all sorts of technical things that the Internet Engineering Task Force does from an engineering point of view, and electrical and electronics engineers look at their health IT. The medical device communication, though, is perhaps worth just underlining. I don't know if any of you have had involvement in the use of medical devices or in determining what is a medical device, but it is a very difficult and important issue to grapple with, because there are all sorts of legal issues to do with the transfer of information across medical devices that make it much more complicated. So, for example, a telecare system could be described as a medical device, or could it? You know, if you sit in front of a screen and communicate with a clinician in a remote location to you as a patient, is that system in effect functioning as a medical device or not? There's an ongoing debate. So this is an example actually of why it's always helpful when you're trying to develop something locally to keep an eye out as to what's happening internationally and globally. And medical devices are generating a lot of medico-legal issues that are really quite complicated to handle. So when next time we talk, for example, about some of the work on health information exchange standards, and for example the work of Continua, then what isn't a medical device is particularly relevant to them. So IE is important, particularly from that point of view. In terms of ones that are particularly focused on health, of course, we have the World Health Organization, ITSDO, I've mentioned to you, they're the body really concerned with standards, particularly around SNOMED CT. Regan Street has been behind that, but that's the Standards Development Organization. HR7, very informative and website and long-established organization, and DICOM. So those are some of the major standards development organizations. You may see them referred to as an SDO, Standards Development Organization. But there's another body that I just wanted to draw your attention to as well before we break the questions, and that's ISO TC 215, International Standards Organization Technical Committee 215, because this is really kind of the health sector's the health sector organisation's connection into the ISO body, and you'll see that they have been amazingly active. There are 125 published ISO standards relating to this technical committee. So I hope that you will look out for ISO TC 215 because it does a huge amount of work. And if you're wanting to check out what's happening internationally, you'll see, for example, in the fourth line down, it's talking about such as privacy, safety and security, medical devices. So if you wanted to follow up what I was saying just now, that would be a good place to start, to get a feel for the sorts of standards that are available or in the pipeline and being developed around medical devices. So ISO TC 215 clearly has to work with a range of other standards related bodies, which I've mentioned to you, and that will also include obviously the standards bodies that such as the IEEE that deal with medical device issues. So I hope that's given you a flavour of the standards and the standards development organisation, and I think I will stop there and invite any more questions, and perhaps deal first of all with the one that I couldn't deal with last time.
All right. You have presented very good listings of standards available, and anyone who has a copy of your slides would really have an easy time on checking out what needs to be done and what should be done, or what should the particular standard should be required in their eHealth implementation. Now let's go to our Q&A from Dr. Jakir from Bangladesh. He said that standards and interoperability is a big challenge, and actually we need leadership to lead specific region and then expand, because otherwise it would the implementations will be scattered and will not have an impact. What are your thoughts on this situation?
I normally give quite a long answer, but I think this time I'll just say totally agree. Just let me flash it out of this.
Right.
I do agree, because actually there does need to be leadership, and the gist of what I've been saying is pay attention and encourage the leaders to lead. Pay attention to what they're saying and encourage them, but you also still have to take a judgment as to when you have to make decisions locally. That may mean that you can't afford to
Peter, sorry, you are a little bit breaking a while ago, and we were not able to hear what you have said entirely. So can you please
Okay.
repeat?
Okay. I agree basically with the proposition that there should be leadership shown by those who are developing interoperability standards internationally, and that needs to happen at international level and at regional level and at national level. And we should be paying full attention to the progress that is being made, and I hope this webinar series is giving you some pointers to help you do that. So I agree, firm leadership at an international level and follow that lead. The only point, challenge, qualification that I would make is that you may find that in some particular circumstances there are actually good reasons for coming up with a more local and perhaps more interim solution. And that's a judgment that management needs to make. And all I'm really saying is, if you do make that call, make sure that you make it knowing what the full picture is. You know, it just may be that there's, let's say, a medical device issue, complex legal thing, and it's quite evident from when you look at what is going on that it's unlikely to be resolved within the next 4 years. But you need something to happen now. So you may need to have something developed that makes sense in a national setting, but say we'll revise that when the international setting standard is agreed. But in principle, I agree with the question. Yep.
Okay, thank you, and thank you also for those who are asking this question. Really helpful in bringing out these kind of issues. Another question: what are good steps for identifying and implementing standards? That's the question.
Yes, what are good steps? Well, of course, it will depend on whether you have a particular area of the standards world to be concerned with. But let's assume that you have a national remit. How do you encourage the Ministry of Health, for example, to take a serious and engaged view about standards? And I think one of the first things to do, my suggestion would be to look for opportunities where you could get the decision makers and the key influencers, maybe people who are the senior people in the clinical community and perhaps some patient representatives as well, to look for opportunities to get them together, either at a conference or to put on a workshop for them, and to share with them some examples of good and bad practice, and then discuss and take some decisions in the light of the findings. But I would say that it would be helpful if that sort of engagement was informed both by input from the standards organisations, from some standards organisations, and it will depend obviously on, if you're having a focus in one particular area or not. But if you're not, then there may be 2 or 3 organisations that may be really very relevant to invite to come and share their knowledge and expertise, and to give you an idea about what is happening internationally. I think the other thing to do would be to try and make sure that you get people engaged with some best practices that are going on in the country. So in every country, in my experience, are always, for a variety of different reasons, some places where people actually do have some real expertise and interest, and where they may be very ready to try out some new ideas, or they may be ready to share some of the things they've been working on locally. So this is where you try and bring together in a constructive way people who are already engaged with local standards related issues, and you try and see how that engagement can be connected with the international expertise and state-of-the-art around standards. Because what you need to implement nationally within any particular country will be helped most if it's a combination of sharing international best practice and intra-country best practice, so that you've got some places that are the leading sites within the country saying, yes, this is what we've done, this is how it relates to the international expertise that's available, and this is recommended as being deployed more widely within the country. So to sum up, I would say, look for opportunities to engage people in meaningful discussions with those who have got good knowledge of theory and practice, international and local, to share, and then look for opportunities to have some demonstrable progress being made within the country. And the more you can get individual clinicians, and indeed, if possible, particular patients or citizens, to be ready to champion the outcome of the work, that can be immensely powerful too. That's helpful.
All right, thank you. I think the key answer to that is we in our own eHealth implementations in our respective countries do have a big problem when it comes to deploying national projects on eHealth. But in all problems, we have answers that are just floating all around, and what we need is to connect to people and to countries and to institutions that may have the answers or the solutions that we have.
Yep, agreed.
All right, we go to our next question from Sri Lanka. Just imagine a case that we adopt a particular standard under one leadership, and when that leader steps down, the new leader may or may not refuse, or may not use or adapt the standard. How do you deal with this? I think he's talking about change of leadership and how to deal with this circumstances.
Yeah. Well, in my view, the health informatics community, locally, nationally, and internationally, needs to be one that is driven by the ethos of delivering what is best value for the citizen, and therefore the frame of reference for leaders is not an ideology so much as a view that it's actually their duty to support good quality solutions for patients. So in my experience in countries that I've worked in, typically the health informatics community is actually really not driven by any kind of party political approach to the evolution of information systems, but is very concerned with making sure that it gives advice and leadership so that the standards that are being developed can be used to benefit citizens and clinicians, and also so that from a commercial point of view, the suppliers of health information technology have a market that they can make a profit from. Otherwise they won't be in business and we won't have the technology that needs to be used. Having said that, the more use there is of open standards-based solutions, the more cost-effective they may be, provided that the whole system costs are taken into account. And it may be in that sort of area where you can see different political philosophies coming into play. I think to try and to summarise, focus on the patient, understand what the generic issues are, and try and avoid having ideologically driven leadership that is politicized at all. And in reality, of course, that may be impossible, but that ought to be the intention, at least, I think, of those who are trying to evolve the right kind of context within which policy decisions are developed for health information systems.
Okay, thank you for that. Another question from Dina from Indonesia. In Indonesia, especially in Semarang City, we use ICD for classification of diseases. But we have problems with drug codes and standards because there isn't an Indonesian national code. Mm-hmm. In our country, in my country, there isn't a regulation about it. We have a lot of variation in the name of drugs, and they do not use generic drug name. Yeah. And it's appropriate if it's currently not appropriate if they adopt an international drug code or standard that other countries are using. How are we going to deal about this?
Yeah, I understand that challenge. I mean, without knowing, unfortunately, the details of Indonesia, my general approach would be use international standards where that is appropriate, but be prepared. So use that as your basis, as the basic template, but be ready to adapt the international standard so that it enables local variations in those areas where it's not relevant or where you've got completely different sorts of drugs. And in answer to an earlier question, I was mentioning the whole range of traditional medicines and drugs that may evolve in particularly unique ways in different countries. So it seems to me the approach really is to take as your starting point the international classifications and then adapt them where appropriate, as opposed to starting with what has evolved within the country and trying to use those in the future, because I think given, as I was saying earlier on, the objective of having information systems geared to supporting citizens, person-centered care, then I think the challenge has to be, so if a person needs to travel, they will need their care ideally to be available in any other country, and the drugs that are used in any other country to be understood, for example, when they return back home again. So I would always think it more appropriate to make sure that you have at least looked very seriously at using the international classifications first of all and adapt them locally rather than looking to build on local solutions and try and improve them without taking any account of the international perspective.
All right, Dina, if you have comments and suggestions, you can also chat it in our chat box. Another question before we go for a question from Taiwan. This question from Pakistan. Is there some good resource materials for making a good case for initiating standardization in our country? Sensitization or best practices?
Sorry, we're making a case for standards, or was that standards in a particular area?
I think he is asking for resource material on how to start up a standardization campaign, something like sharing good practices, or I think he's asking for a case study or a way on how to do a national standardization campaign. I think for the country to push forward using standards. Or maybe you could share your experiences in the countries you have worked for in terms of implementing standards.
Yes. Well, okay, I've got two answers. First of all, we're going to have to stop very shortly because we're coming up to 1:30. I think, although I could share some knowledge, and I'm giving you pointers to some and some history, basically, of places I've worked in. My suggestion would be that this is exactly the sort of question that AeHIN needs to get its answers together for. I would say this is something where, having regional sharing of best practices would be a great opportunity for you. And I don't know whether that has already happened or not, but if it hasn't, then I think answering that question, having locally relevant material would be great. If that proceeds, I'd be happy to see if I can complement it with other material from elsewhere. But there aren't shortcuts in this. It does take time. The important thing, I think, is to have at senior leadership level within the ministry preferably a civil servant who will be there when the political leaders have been and gone, having some senior civil servants there who can take a serious and engaged view and understanding of what the issues are and can make sure that that knowledge is developed and shared in a relevant way within the country. But basically, I think, first of all, I think it's over to AeHIN to answer that one. That's a challenge for you.
Right, very interesting. From the question of Dr. Shed, maybe AeHIN could develop a publication which contains the stories about how countries implement their standards, or maybe the stories on how they transition from just plain eHealth implementation to fully functional strategy which considers standards. We have one last question before we end from Taiwan, from the Taipei Medical University, basically from Pakistan. I would like to ask Dr. Peter about challenges currently facing in Pakistan regarding polio vaccination. What did his experiences suggest to mitigate this problem? While these days, mobile health is also successful to collect child data from countries to track properly. I think his question is, what are your experiences in mitigating polio, the problem in polio vaccination, while there exist mobile health solutions.
I entirely understand that question. Elliot, can I suggest if you could send me an email that captures that question?
All right.
Paste it into an email and send it to me. I'll see what I can get by way of a thoughtful response by Monday.
Okay.
But I'm conscious that we're on the hour, and I've just got a couple more slides to get through.
All right. Okay. I think we can move on to our next slides. I'll take note of Dr. Usman's question so that he could be answered comprehensively. Go ahead, Peter.
Okay. Thanks. So again, just some material for you, some examples, and I've looked for the online training courses. So yeah, just to give you some pointers to explore that I hope will be helpful. The one at the bottom, the Internet Society one, covers some of the legal IPR, copyright, security and privacy issues, but it's more really for citizens. And just to note that the ISO standard certification is performed by external certification bodies, and these are largely private. So those resources, I hope, will be of some help to you if you want to get some further training. And similarly for the major clinical areas, those are some initial links for you to be looking at and following up if you wish. Okay. So finally then, we have the quiz time, and I hope all of these questions are self-explanatory. I have covered them, each of them, in the webinar, except for the ones that are particularly asking about your country. There's no kind of right or wrong answer there. It's more just a challenge for you to think about the issues and to see on reflection what your thoughts are. Because, you know, part of the reason for doing these webinars is to try and encourage you to connect what I've been talking about with the realities of what are going on in your situation and how best to address them. So those are the questions for the quiz. Answer please online as before through the AeHIN site. And just to say that I look forward very much to sharing with you some thoughts about health information exchanges on Monday. If there are final questions or suggestions, I'd be happy to have them now.
Okay. For those questions which were not addressed this afternoon, we will be answering that at the start of our session by Monday, that is May 19. So if you also have problems logging in, please be reminded that all details about our sessions are posted at www.aehinacademy.org, and all the meeting details and slides and quizzes can be found there. So if you have classmates in your countries that are no longer attending, please do encourage them that they can still access all resources in that website, provided that they have enrolled themselves. So thank you so much, Peter. Thank you to all 32 participants who attended to our session this afternoon. See you on Monday.
Okay.
Thank you. Bye-bye.
Bye now.